health issues related to the human circulatory system, and the necessity for a healthy circulatory system. A healthy circulatory system is important to ensure optimum health. And how do we do that? So these are the practices. That is to have balanced intake of food, the one that is low in fat, having regular exercise, the practice of not smoking, and not drinking alcoholic drinks. Do you know that cardiovascular diseases are the leading cause of death in our country? What are cardiovascular diseases? These are the diseases related to the heart, cardio, and also the blood circulatory system, vascular. So these are the list. That is arteriosclerosis, which is different from arteriosclerosis. We also have angina, which is severe chest pain, hypertension, that is very high blood pressure, myocardial infarction, that is heart attack, and also stroke. Now this is arteriosclerosis, which is the formation and deposition of plaque on the artery walls. This is the normal cut section of the artery, and when there is tear in the artery wall, there is injury. What will happen is that there will be dead muscle tissues as well as coagulated platelets in action. So the plaque is formed from cholesterol, which comes from diet high in fats, from lipid, from dead muscle tissues, as well as coagulated platelets. So the plaque will clog and narrow the lumen in the blood vessels. This is the picture of a narrowed artery becomes blocked by a blood clot. So that is arteriosclerosis. But what is arteriosclerosis? It is actually the late stage of arteriosclerosis, when calcium starts to deposit on it and cause the artery to become hard and hence lose its elasticity. But what about hypertension? Hypertension is caused by the restricted blood flow. Restricted blood flow may be because of the narrowed lumen of the artery. So hypertension causes the fine arteries to break, and the patient may suffer from stroke if it happens in the brain. If it involves the arteries in the brain, then we say stroke happens. Stroke is also caused by the blood clots. Still remember the thrombus just now that clogged the flow of the blood in the brain? And how about the condition of the heart? If the lumen of the coronary artery, which is the artery of the heart, is the one that has narrowed, what will happen? That will cause insufficient oxygen supply to the heart muscles, and this may cause very severe chest pain, and we call it as the angina. Angina, if the artery is completely clogged, so we say heart attack happens, and that is myocardial infarction. Infarct means die. So that means the heart tissues dies off when it is not having any blood supply. Now this is the formation and deposition of plaque on the artery walls. You see, this is the blood flowing within the lumen, and now the lumen has become very narrow, so you say the blood clot over here restricts the flow of the blood. And also there is plaque formed in the inner walls of the artery. So imagine if this condition happens to the artery of the heart, which is the coronary artery. So it will cause first and foremost angina, and then dead cardiac muscle tissues if it is extensive. Right?